want to talk about the response I got after I shared this experience on Threads. Because what happened next is just as important as the appointment itself. I started getting responses from people in medical professions, and the most common one by far was this: he was just doing his due diligence. I saw that comment hundreds, if not thousands of times. So let's talk about that. If this were due diligence, the first step would have been reading my chart. He wouldn't have been visibly shocked when he walked in. He wouldn't have needed to bark, "Why are you in a wheelchair?" If he were actually gathering clinically relevant information, he would have asked other questions. He didn't ask about my arm symptoms. He didn't ask anything related to the surgery I was getting ready to have. That is not due diligence. That's selective curiosity. The second most common response I got was this: he had to ask about your bowel and bladder control because of the surgical sterility concerns. That argument does not hold up. Number one, he was not part of my surgical team. Two, if sterility or surgical risk were the concern, those questions would have come from my surgeon or the anesthesiologist. And three, disabled people are not inherently a greater risk in the operating theater. In many cases, we're less of a concern. I catheterize, I have a bowel program. Before the surgery, I fast just like anyone else. I empty my bladder completely right before going back, and I perform a bowel prep. There is no increased sterility risk. What these responses reveal is not clinical reasoning. They reveal an assumption that disabled bodies are inherently messy, risky, or suspicious, and therefore always require justification. And that assumption is exactly what ableism in medicine looks like. Not overt cruelty, but reflexive defense of the system, even when the facts don't support it. This series ends here, but next I'm starting a new series about the accessibility barriers in medical spaces. Because ableism in healthcare isn't just about attitudes. It's about a healthcare system that was not built for disabled people and often doesn't believe our lives have the same value to begin with.